Well, welcome everybody. Appreciate you taking time out of your busy schedules to be with us this afternoon. This is the mini More Profit Roundtable for Community Pharmacies. As I had stated earlier, we do a full hour long roundtable once a month on the second Wednesday of each month. And we have a lot of things that we show in that hour long. We're going to only take about 25 minutes this afternoon and really get to the main core principles of clinical services. I've been preaching to community pharmacies now for over a couple of years that they need to get involved in more clinical services to not only bring in more profit for their pharmacy, but to bypass the PBMs, which is key, right? So, um, my name is Breck Rice. I'll be your host this afternoon. I've been helping community pharmacies for over 20 years, about 22 years now. Absolutely love the industry, but I've seen a lot of hardships in the industry. And most of those hardships could be traced back to the poor reimbursements that pharmacies are getting from the PBMs. That is one of the reasons why I host the PBM Reform podcast and do everything I can to make positive changes in PBM. But you can see by this slide here that all of the payers are aligned with the pharmacy benefit managers that are reimbursing the pharmacies, and this mafia wants nothing more than to put independents out of business. They're aligned with the big chains, and that's all they want to see across the country. And so I'm pretty excited to share with you the steps to success in getting involved in clinical services. With step one, working with George and his company, Seniors Home Services. And Seniors Home Services is an amazing program that George brought to me a few months ago that is offering remote therapeutic monitoring and some other remote monitoring services that we'll get into in just a minute. But it fits perfectly in with what I had been preaching to community pharmacies that they need to do in getting involved in clinical services. Now, I know that there are some costs associated with, getting set up to do clinical billing and to be in the medical networks, all that credentialing cost. And so, even though we found a solution that is less than half of what everyone else is charging, there was still a cost to it. So when George said, hey, Seniors Home Services has this opportunity that they've been taking to doctors, but wouldn't this work for community pharmacies? I said, absolutely, this would work for community pharmacies. And what's so amazing about it is there is no cost. A pharmacy can get started with this with no out of pocket and earn pure profit. So we're going to get into step one of remote therapeutic monitoring. And then I'll just highlight step two for clinical or medical billing. And then step three is the full brick and mortar clinic. We'll just touch on those. But today I want to really focus on how to get you started making pure profit with remote therapeutic monitoring. So back to you, George.
Well, thanks, Breck, and really appreciate the time and welcome everybody, especially our pharmacists, to take a really good evaluation looking at this over the next couple of minutes. My name again is George Veronis with Senior Home Services. I'm the Vice President of Sales and Marketing, and I love doing this every week and presenting this because this is not a revenue source for pharmacies. This is actually a pure profit source, and in the range of anywhere from usually $2,500 to $5,000 extra a month with no cost to the pharmacist. So I'm going to go through this. It's something great for your senior patients. It's covered by both Medicare Part B and Advantage plans. It helps patients with improving memory, improving balance, cognitive issues, reducing stress, better decision making, better quality of life. And for you, the pharmacist, simply for just administrating it, you get paid $25 per patient per month. So this is a pure residual. That'll equate to, with 100 patients, $2,500 a month. It's completely turnkey, no additional staff or capital needed from you. And one of the reasons Medicare is paying for this is because when someone just, for instance, falls, an elderly person, cost Medicare from $15,000 to $30,000, $31 billion last year spent on that. So they're looking for ways to help the seniors, obviously, to cut down on Medicare. So I'm going to play you a couple short videos, two or three of them in this presentation to give you a good idea. And then obviously at the end, You can talk to the person that invited you on this, and they'll answer more of your questions and show you how to get started. So let me go to the first video.
It's no secret that pharmacies are under financial stress today and need to find new sources of revenue within their existing businesses. Seniors Home Services is happy to introduce you to our Remote Care Today program that can provide tremendous benefits to your customers and new revenue for your pharmacy. Our remote care service is clinically proven, done over tablet or smartphone, and a Medicare reimbursable program that can help prevent, treat, and often reverse chronic illness, musculoskeletal disorders, memory loss, cognitive regression, and loss of balance, thereby slowing decline while helping prevent falls and loss of independence. Our remote care services are backed by years of success in improving patients' quality of life, helping them remain independent for as long as possible. You can make these services available to your patients as we provide a turnkey solution, including patient engagement, enrollment, support, and Medicare billing under our Medicare NPI. Our patient engagement process is easy and fun with our complimentary Turn Your Selfie into a Healthy app and does not require any additional work for you or your staff. This biometric facial scanning app, which we personalize to your pharmacy, uses smartphone facial scans to read blood pressure, heart rate, oxygen levels, and risk factors with incredible accuracy, engaging patients in their own health by knowing their numbers, anytime, anywhere. We also provide posters and bag stuffers with QR codes. As people use the app and receive results, they naturally engage with our support team and learn all about how our services can improve their quality of life. Information on your patient's monthly progress will be available in our secure portal, and if you choose to review their assessments each month, you can earn administrative services fees for the time you spend, all while helping your patients live better and longer.
So that takes us to the three buckets of areas that we focus on as a company, which is chronic care management, remote patient monitoring, and remote therapeutic monitoring. And we focus with the pharmacies first and foremost in the RTM arena, because everybody could qualify for that potentially, and also you get an administrative fee. I mean, Breck, do you want to mention anything else about the other two, or do you want me to just continue on that?
Sure. No, these are expansion opportunities for the pharmacy without getting fully credentialed. Once the pharmacy is credentialed as a medical clinic and has a new NPI for their clinic, then the scope of services will be expanded tremendously. But what the benefit of working with Seniors Home Services here is that you can add chronic care management, to do medication reconciliation, things that our pharmacies are already doing today, but just not getting paid for or compensated for. You now can get compensated through Seniors Home Services. The other benefit with working with Seniors Home Services is that no one vendor can do all three of these and bill Medicare. You could do two out of the three, but you can't do all three. And so Seniors Home Services actually has a collaboration with multiple vendors that they work with and partner with. So the pharmacy could benefit from doing all three and taking care of that patient and then get an administrative fee for that. So thanks, George.
Great. Yep. Good. So let's really go into remote therapy, therapeutic monitoring for a minute, so you have an understanding. And then I'll show you a little video on one of the programs that we brought into remote therapy that actually does pay for your patient.
Remote therapeutic monitoring, RTM, is a clinically proven and Medicare reimbursable program that not only helps recovery from accidents, but can be directed to help prevent and often reverse memory loss, cognitive regression, and loss of balance, thereby slowing decline and helping prevent falls, as well as helping with stress, anxiety, working memory, concentration, decision-making, and emotional control. In addition to the physical improvements patients can see, these programs can improve plasticity, which will improve patients' quality of life, helping them to remain independent for as long as possible. We are pleased to make RTM available to your patients and make it so easy as we provide a turnkey solution, including patient support and Medicare billing under our Medicare NPI. Introducing RTM to your patients is easy as we do the entire introduction and education for them. We'll send them a landing page, which can include a short video message from you, as well as educational videos, and then give them the opportunity to enroll right there. We'll also reach out by phone to assist with the enrollment process. When they enroll, our coaches personally call by phone to welcome them and send a welcome email with logins to their personal customized programs. Their personal coaches are available by phone as needed to help them along the way. As with all our programs, we take care of all patient support, coaching, encouragement, and all billing. Remote therapeutic monitoring can have a major positive impact on your patients without creating any additional work for you or your staff. Just click the Get Started button on this page to begin.
So anyway, we focus really on age-related changes, right? Working memory, as you call it, memory recall, response time, balance, falls, dementia. It's probably the two most common things that seniors are worried about and thinking about all the time was, I can't fall, right? Because that's really bad. And secondly, I don't want to lose my memory or get dementia, et cetera. So they're very active in both of those arenas to look, and we have perfect programs for them. So the one that we are brand, there'll be different programs out there, but the first one we're going to introduce to everybody is a product called Brain Savers. It's been around for several years, and it's excellent. It's a 10-minute exercise that seniors do once a day. They have to actually do about a half a month, 15, 16 days a month, and then they're covered by Medicare for it. We give them reminders, texts, emails, all of it to keep working on it and getting on it. We have assessments, so they really see results, and they tend to stay on it. So let me just show you a quick 1 minute on that. Tell me if you see my screen. Can you see my screen, Brett?
Yes.
Okay. So let me play you 1 minute on that so you get an idea of what I'm talking about.
Brain Savers is a pioneering, evidence-based lifestyle program designed and developed to promote healthy brain aging and reduce the risk of what is currently the 5th leading cause of death, and that's Alzheimer's disease. I'm Dr. Paul Bentheim. I'm a neurologist, and I led the development of the Brain Plus Body Total Lifestyle program.
I'm Dr. Gina Touch Mercer. I'm a geropsychologist.
My name is Angie Moore. I'm Programs Manager for Brain Savers.
I make up several of the brain workouts and many of the lessons on cognitive fitness, socialization, and stress management.
My focus is developing the physical fitness aspects of the class as well as the segments of the class that have cognitive and physical exercises combined.
This curriculum was designed and developed to enable aging Americans to live an enriched lifestyle in place while reducing the risk of Alzheimer's disease.
You can't function well unless you're feeling well, and when you're feeling poorly, it will affect your brain function. We use the science of positive psychology to construct our lessons and our activities to help people function better.
The program we developed is evidence-based. This means that we used published research studies to develop everyday engaging brain and body workouts.
So what we do is make activities that really are building new connections and new nerve cells or brain cells so that older people can function more effectively, they can remember better, and they can have a better quality of life because their brain is functioning better.
Being physically
There we go. So that gives you a little bit better idea of part of the program. This Friday, we'll have a full video that's anywhere from 2 to 6 minutes that'll give you a better perspective of what Brain Savers is, even showing you a few of the exercises that seniors do. So again, the product's great, the service is great, and it's just all in the remote therapeutic arena, which we then can have, again, Medicare Plan B and Advantage Plan covering it. So let me move on. And then this is how easy it is for you. We're not asking for a lot of work. You don't have to have an MPI number. It's run through us. Is basically administering this and doing a 1 minute exercise per patient, which will take you very little time. So let me show you exactly what you need to do.
Working with our program is easy for you and your staff. If you choose to review your patient's monthly progress and earn administrative services fees, you will be sent a weekly email notification reminding you to log into your portal and review patient assessments. You or an appropriate member of your staff will review these reports, review the summary data for the patient, add your notes, and then simply click the sign-off box next to the record. It's that easy, and it's that fast.
So that's it. So as Brett loves to
We're-
say, if you have 100 patients on this and it takes you a minute or so, it's probably 2 to 3 hours of work in a total month to earn $2,500 in that case, about $1,000, $1,200 an hour. And the other neat thing is our whole goal is to have you really just do that. So we do all the marketing. Obviously, if you help out, it might go quicker. So we have, the selfie to healthy that you saw a little bit. I'll show you one more video on that so you get a good idea. We have all kinds of stuff that we'll put out there and market, including if we get your database and it's all HIPAA compliant and you sign a BAA, you'll be protected by that. But the people that do that, we get to the clients a lot faster, the patients a lot faster. So let me show you that video and then we'll wrap it up and Brett could go and tell you a little bit about medical billing.
In today's healthcare environment, one of the biggest challenges for medical providers is engaging patients in proactive care. It's hard to convince someone they need help when they don't even recognize the signs. But what if there was a way to make the need clear without you having to be the one to do it? Meet a revolutionary solution for patient engagement, AI-powered facial recognition. We call it Turn Your Selfie into a Healthy. Imagine a technology that helps your patients track their health, identify risks, and stay engaged in programs like our health and wellness coaching to keep on track with their health, all without you having to perform the assessments or having lengthy discussions with the patients. This advanced technology provides an easy-to-use, self-guided experience for your patients. They can complete assessments from the comfort of their home, gathering valuable data on their own through a 30-second AI facial scan using their smartphone. With 96% accuracy and 98% repeatability, it can analyze metrics like heart rate, blood pressure, oxygen levels, health risks, and others. This is not a substitute for medical care, but it is an accurate way to identify symptoms that just might help your patient recognize the need for lifestyle changes and to make healthier choices with diet and exercise. In addition to the immediate on-screen results, a detailed report is also generated, which we will review with the patient and educate them on how our remote care services can be so helpful. It could also encourage them to become more engaged with our proactive cognitive improvement program, designed to improve both memory and balance. We provide marketing materials like posters and countertop materials. As people use the app and receive results, they eagerly engage with our support team and learn all about how our services can improve their quality of life. This isn't just about making your job easier. It's about empowering your patients and improving outcomes. So, what's next? Speak with your care consultant today to learn how you can enroll in the program and start offering our remote care services to your patients, all with no upfront costs. Together, let's make proactive health easier for both you and your patients.
Great, you're getting a pretty good idea. Excellent program. Everybody's looking to do it. I can tell you, we've spoken to probably over 250 pharmacies that already are onboarding right now with us. In fact, Brett and I just got off with a large pharmacy with over 50 locations, and a couple of their comments were, wow, great, we could have something that really help patients. Our pharmacies are always looking for more profit. It's great, we don't have to put anything into this. And wow, it's going to be a fun program to integrate, as long as our pharmacies aren't overwhelmed by and busy. And of course, we assure them, as you just saw in the videos, that we do this all. So I'll wrap it up with how easy it is to get started and all you need to do. And then you can get back to the person. I'll turn it over to you, Brett.
Yeah, thanks. And
Let me finish this one video.
Our process is simple. First, we'll create your co-branded, Turn Your Selfie into a Healthy app and provide a customized poster and bag stuffers for your pharmacy. Your patients see our materials, scan the QR code, and are taken right to your selfie app without any downloading required. They fill out a simple opt-in form, followed by taking their own selfies. Within seconds after taking their selfies, the patient receives their scan results, along with information about our remote care programs, and are encouraged to contact us to learn more about their results, as well as about our paid-for by Medicare health and wellness programs that also improve balance, memory, and quality of life. To get started, your next steps are easy. First, complete our agreement and sign the BAA, which ensures HIPAA compliance, and then we'll schedule your onboarding meeting. During this meeting, we'll discuss how we engage patients and the materials we can print and provide you that help patients engage with us. We will then educate and onboard your patients using approved text messages, emails, and friendly phone calls, providing the patient the appropriate programs and coaching, all without any cost to you. Your pharmacy then has the option to provide monthly data reviews for each patient, which earns you monthly administrative service fees. Better patient health, new revenue for your pharmacy, improved patient loyalty. Let's get started.
So, Breck, I want to thank you for giving us this great idea to talk to the local pharmacies. We're having a lot of fun and a lot of success. And, again, as I got to know you more and understand your program and how it even adds more potential profit to the pharmacies, is a great combination. So I'll turn it back over to you, and you can wrap up on the medical billing and your BRIM. Go ahead.
Yeah, I was just going to mention earlier, George, that selfie to healthy. I mean, that's like James Bond stuff right there, like a secret agent thing, taking a scan of the face and being able to get all those biometrics for patients is absolutely amazing. And I understand it's going to be 100% complimentary. It's going to be free for our community pharmacies to utilize too as well.
Sure.
So,
Yep, for sure.
yeah. So IPPN, the Independent Pharmacy Provider Network, is the fastest growing healthcare collaboration in the country, connecting doctors with community pharmacies. And the pillars to success here are the pillars that IPPN brings to the table. These are the things that are needed in order to be successful in medical billing. These are also the same pillars for failure. And I've seen more ways of doing it wrong way than I have seen the right way. And so it's very important that our community pharmacies understand that you need to have a turnkey software solution to be able to do the patient engagement and do your notes and requests from the collaborating provider when you need to add something to the care plan that they're managing. Pillar two, you've got to have that collaboration. You've got to have a medical director that is working with you. And so you've got to have a CPA in place, and it should be somebody local to you. A CPA with a provider across the country is not as efficient as somebody that's right there in your own community. Pillar three is the recruiter recruiting. You will have some key physicians that you have relationships with already. That's great. Those are the easiest ones to approach. But IPPN is bringing in complete ACO groups in order to work with our community pharmacies. So a lot of doctor providers. Then pillar four is you need to properly know how to pay and collect. One of my poor pharmacies went with a group that helped them get credentialed, and it wasn't IPPN. And they started billing. They're sitting on over $100,000 worth of medical bills they cannot collect on yet. So IPPN is actually helping them now rebill those, because if you don't know the proper modifiers, you're just not going to get paid from the payers. And this isn't just for Medicare. This is for all commercial payers as well as Medicare. So next slide, George. Here's just some examples of some of the services and CPT codes that you can bill for. The preventative visits, office visits, and then eventually the diagnostic services. This will turn a $20-$25 flu shot into an $85 preventative visit for our community pharmacies. So you can expect to add an additional $300 to $1,000 per patient annually with this program. After you have IPPN in place, then the third step is BRIM Wellness. And this won't be for everyone. This is only for pharmacies who actually have the space for it. You can do IPPN without a large clinical space. If you're giving vaccinations, you can do IPPN. But if you want the full brick and mortar, that's what BRIM Wellness is all about. And you own it. The pharmacy owns the clinic, but it is not, it's managed and also can even be staffed by BRIM as well. That way you're only paying for, somebody's staffing the clinic when you actually have clinical visits. That's the talent exchange. So imagine kind of like Uber for nurses and medical assistants. So that's a pretty cool program. And then the third leg of that stool there is a financial funding and credit vehicle that the community pharmacy can not only borrow from in order to do the build out of the clinic. So you need a footprint of about a 10 by 12 foot space. but then you can also contribute to that fund and earn a very fair interest rate on that. So it becomes another financial vehicle for our community pharmacies. Plus, you're helping the next community pharmacy get set up. So that's the program in a nutshell. As promised, we wanted to get this to you in under a half hour. And why don't you just wrap it up, George, and take it
Sure.
back
Well,
to the remote
first of all,
therapeutic monitoring.
yep, great information. And again, it's how we started, right? Yeah, the ultimate is you're going to help all your senior patients with something they absolutely need. You're going to be able to take advantage of the administrative fee, so you get paid versus the doctors. And it's a win-win-win for everybody that's involved in the program. It'll make a big difference. And obviously, if you move into the stages 2 and 3 with Breck, it's even a bigger win overall from an economic standpoint for your pharmacy. So I've been in this just recently. I learned a lot about community pharmacies. I love it. I love what you're doing, Breck, and where you're going with this thing. And after several months and probably talking to about, I'm not going to say 200, somewhere bigger location, probably at least 50 pharmacies. Everybody is very appreciative that we have a program like this, but shockingly, a lot of people haven't heard of this or don't know anything about remote therapeutic monitoring. So it's good that we're educating and bringing that to the
Hey,
marketplace.
George, this is Dr. Eric, and I want to give a shout out to Valley Green Pharmacy that hopefully on the call today. But their question to me is, you talk about Medicare, and they say an awful lot of their people are not Medicare. You mentioned it twice in the presentation. A lot of people have Medicare Advantage. How does that play in?
So you're saying they're not Medicare Part B, but they are Advantage, or they're neither?
It might be both. They might be both.
Yeah. Well, yeah. So as long as they have covered by Medicare Part B or Advantage plan, either one, then they're going to qualify for the program. And if they,
Okay,
for instance,
that answers the question. That answers my question. I didn't hear the Advantage program, and you mentioned Medicare twice, but I didn't hear Advantage.
yeah, we
Okay,
had it
great.
at the beginning and the end, so it does do Advantage plans. In fact, we had another program that we also liked in remote, but in therapeutic monitoring, but it only covered Medicare Plan B. And the program we now have with Brain Savers does do both, so it opened up the market, obviously, so everybody has an opportunity to qualify. And of course, it opens up the market double for the pharmacists. We found that about 60% of the people are on Advantage plan versus Medicare Part B. So it expanded the market to a big level. So let me do this, and then we can ask more questions. I'm just going to wrap this up. I thank everybody. Get back to the person that introduced this to you, and they'll answer more questions. They'll send you out an agreement. You can look that over. And then what happens after that, if you agree to it, we call you within a week. We do an onboarding with you or a champion in your office. And we show you all the ways we're going to help you get to patients, and we're going to do it for you. And we outline that, and then you're off to the races to do this. So I'm going to go ahead and stop the recording, but if anybody would like to ask questions, we will stay on for a couple of minutes. So thank you, Breck, and thanks everybody.